I think engagement journalism is really about meeting people where they are and taking news to them in ways that'll actually serve them.
Engagement journalism really puts journalists in touch with the community in ways that sometimes they would never experience.
My sense of reporting has definitely enhanced since I've been doing this engagement work. I feel like I'm not doing as much taking, as I am giving.
Engagement journalism fundamentally rethinks the relationship between reporter and source, newsroom and community. It no longer posits the journalist as the ultimate authority. It's saying that the community has the best insights about how a certain issue is affecting them and how solutions might play out.
My name is Alexa Imani Spencer. I'm a Pensacola native. I'm standing here with you today because I'm working on a special project about the health effects of racism on the Black community. How does it lead to stress? And ultimately, how does it lead to chronic illness among Black Americans? In this project, I'm investigating whether reparations can resolve health disparities in the Black community. This particular conversation had to happen in Pensacola because here is where my family has lived and died for generations, some of them prematurely. I'm excited to be back home to listen to your stories and hear your thoughts on the state of life in Pensacola and also the state of health for Black people. Being able to come to Pensacola and be on the ground and just allow for things to flow, allow for the story to shape itself, has been amazing. It's something that we don't get when we're reporting remotely.
It goes beyond community outreach. It's about inviting the affected community into the reporting by not just asking them questions and engaging them in the work, but really receiving feedback.
Let me give my mommy a hug.
Hi. Hey, baby, how are you? I miss you. I missed you too. You look so beautiful.
Thank you.
You're gonna make me cry.
You gonna make me cry. With my engagement work, I hoped to report what I knew was true. I came into this journey with knowings. Having lived as a Black woman, having looked at my family and the generational patterns in my family, I knew that it just wasn't us who have experienced perpetual trauma, perpetual poverty, perpetual mental illness. And so I wanted to connect the dots from coast to coast and let people know this is not just happening in the Deep South. There are Black folks living in a weathered state, regardless of where they are, because it's not about an interpersonal interaction of racism that is simply leading to these outcomes. It's systemic racism. It's the fact that Black folks everywhere are dealing with systems that are working against them, but are working as they were designed. Having mentorship and a partner through the Center for Health Journalism has made this so much easier than it would have been if I was doing it on my own. I may be the one speaking on the panel today, but Tina is the one that's behind all the details. And she was just very graceful with me, throughout the process. And that made a difference for me.
Our hope with engagement journalism is to be missionaries of sorts and to really get people excited and galvanized and really to help build bridges in communities that have long had a fair bit of mistrust between newsroom and community. The Center for Health Journalism helps reporters in resource-thin newsrooms to do the kind of project that they would like to do but would find it greatly difficult to do in today's news climate. The Center began its engagement work in 2012. At that time, it was really a very new phenomena in any journalism, and since then we've really deepened this work, fine-tuning what we do in response to a reporter's needs.
I was inspired to do this project after spending the past several years reporting on deputy gangs within the Los Angeles County Sheriff's Department. After looking at all of the misconduct and crime that deputy gangs are responsible for, I got really curious about how the shootings that they were doing were impacting the neighborhoods where they were occurring. The data showed me that most deputy shootings happen here in the city of Compton. Community engagement was really essential for this project because the project is really focusing on how these shooting incidents were impacting people living in the neighborhood. The first thing that I did was to reach out to groups that were already working in the city of Compton around this issue. I created a survey for people to fill out that asked people about any changes that they had noticed in their physical or mental health after an interaction with the Sheriff's Department. And I also hosted a town hall where I invited people that lived in these census tracts with the highest number of shootings, as well as anyone that completed the survey or was interested in learning more to come and share about their experiences.
At the event, seeing people come together over deputy shootings, it was a heavy topic, but it was done in community. It was a very open and inviting space where people felt like they could share. And people came up to Cerise after the event and thanked her for bringing people together over something that is often talked about behind closed doors.
I've heard from different people working in different branches of county government that have used the databases and the work that they're doing. I'm hearing about the impact day to day. I am really grateful that Cassie was there to assist me with this. I was managing a team of about 7. I was planning a live event. I was canvassing neighborhoods. I was creating a survey. And somewhere in there, I had to write the series as well. This reporting wouldn't have been possible without the Engagement Project.
I do believe it takes a village, to raise and create anything. And this project I simply could not do by myself.